Yep, we're recording. So we generally start off with me talking. That's it.
Used to that.
Yeah, it's pretty standard stuff.
Yeah.
So
Yep, that's right. Hello, everyone. Thank you for joining us here on the Flux cast. Once again, we are joined by the Simon to my Garfunkel. It is
I'm
Brianna
waiting for you
Porter.
to run out of those.
I will never ever run out of them. Never ever ever. Hi, Bri.
How is everybody?
Now tonight we are joined by an older gentleman. That's why we've gone to Simon and Garfunkel there. something he'd know.
Sticking with a theme.
And we have a special guest tonight. It's someone who Bri and I both know very well. We have been working with this person for a very long time. I'd like to say good evening to Daryll Knowles.
Good evening, guys. And I like your Simon and Garfunkel reference. Is it to pouring oil over the water or a bridge over troubled waters?
No, you've lost us. So just for anyone out there that's listening and doesn't know, Daryll Knowles is a former compounding pharmacist. He was the owner of Australian Custom Pharmaceuticals. Currently, Daryll is the Chief Commercial Officer of the Verita Pharma Group. Now, Verita includes a subsidiary called Kookaburra Labs, and that's what we're here to talk about tonight is Kookaburra, which is a new analytical company dedicated to testing for Australian compounding pharmacies. So we want to speak to Daryll about the current testing landscape and requirements in the Australian compounding guidelines. So, Daryll.
Thanks, Matt. Testing in compounding pharmacy has long been a contentious issue. And now with the new regulations coming in and being enforced, we're finding that it used to be a nice to have, but now it's an essential to have. And the problem that's always been in the compounding market in Australia is there has been no testing facility that understands the requirements of compounding pharmacy. All of the big GMP facilities and TGA labs and APVMAs all use labs that are geared to GMP testing.
And it's a whole different level of understanding even, because pharmacists haven't had to deal with technical testing and that sort of thing.
Absolutely. It's a level which we come across all the time because we have a TGA license. We understand the difference requirements between the TGA testing and the compounding pharmacy testing. Now, while it's essential that the testing reaches a certain level for compounding pharmacies, and it is carried out in a regulated TGA or NATA lab, it is always preferential to have the TGA testing badge on your results. The thing that we found in Australia was that there was nobody that really understood compounding. So this is where we saw something that the market was really screaming out for.
So just, sorry to interrupt, I just want to get a qualifier there. Daryll, how long were you compounding for?
I was compounding, I don't say it very often, but I've been compounding since 1988. Myself and my business partner at the time, Grant Ovens, were the first modern compounders in Australia. We did not have any wholesalers in Australia at that time. We had to import every product, including anything we bought from the mainstream wholesalers, into Australia. So we had to test our products very early on, which led us to start up our own testing facility, which we have now taken to the next level, and it's a TGA license facility. So my pharmacy's always had extreme testing on all of their raw materials that we imported and all of the finished products. And we did release rate testing, and we did a lot of things. And this gave us a lot of experience in the requirements, the essentials and the nice to haves. There's a difference, and you can spend a lot of money on testing if you're not aware of what's essential and what the regulators expect. And the regulators now have become a lot more savvy in the last 5 years, and they are weaponizing testing, which is not really a great thing. It's compounders should be doing their testing anyway for patient safety, but now it's becoming a fact that the regulators are weaponising testing requirements, and compounders have to be aware of what their absolute essential testing is.
It's also to do with the TGA quality requirements as well, and that's something that I know the APF 25 has actually explicitly stated this time, which is great, is that compounders are not exempt from the TGA quality standards.
Correct.
We don't have to have manufacturing licenses, but you still have to comply with the quality requirements. And so I guess that's where you come into saying you have that TGA licensed laboratory badge is really important. Because in the APF, they talk about a TGA facility or a NATA accredited. Can you explain the difference there and why one would be better than the other?
TGA is held to a higher standard than NATA. The NATA testing labs, we actually have a NATA testing license as well, and it's not as strenuous as the TGA. We always test to TGA, and for raw material identification and purity testing, the Pharmacy Council regulations in New South Wales expect that as a minimum standard.
Yeah, right.
And this is to do with the pharmacopoeial testing. So either it doesn't require full pharmacopoeia, but it will require a very minimum finished product testing and technician testing and facility testing.
Yeah. Facility testing. What do you mean by facility testing?
The ability for the machinery and the equipment to prepare reproduce on a regular basis the same product. So to test your product, if you mix it in a mortar and pestle, it can comply, but maybe it doesn't, depending on the operator. One operator might be a 100-kilo male that stirs very vigorously and hard, or it may be a 50-kilo female who doesn't have the power. So you've got to make sure that when you're using mechanical means and not automated machinery, that your end product is the same, and testing is required for this as well. So this is where your end product testing comes in, and also there's a lot of overlap in technician testing and finished product testing, especially when it comes down, and the machinery involved, the equipment involved is a very big factor of that, and not many people realise this.
So like the testing part, it's not just about the quality control at the end, it's also quality assurance. It's in both sides of the quality management.
And I myself, I've only realised in my later part of my compounding career the difference between quality assurance, quality control, IQ, OQ, PQ on the equipment. You've got to have
There's like
equipment.
6 other shirts I could make.
It's all of these things are not exempt under the TGA, and if the TGA ever gets control of compounding pharmacy due to our inability to comply, this will all become normal. You will not just buy a piece of equipment. You will have to buy a piece of equipment. You'll have to qualify it. You'll have to do all of these IQ, OQ, and PQ in your system.
That's what you have to do in TGA, right?
We haven't had to do that yet. In TGA, you have to. If you move a piece of equipment from one part of your lab to another, you have to requalify it.
Yeah, right.
Thankfully, we don't have that level, because it really would make it unfeasible to.
You couldn't compound on a patient-to-patient basis. It would just, the cost would be phenomenal.
Yes, but when it comes to basic testing, the testing of your technicians is a requirement and is essential, and it should be done on a regular basis.
Especially if you're QCPP accredited, they require 2 drugs, 2 dose forms per person per year.
Correct.
So that could be 2 products. It doesn't have to be 4 products. I know some people
I was just about to ask that.
Yeah, because some people would read that and say, okay, that's 1, 2, 3, 4. But if you have a progesterone cream and a melatonin capsule, that is 2 drugs and 2 dose forms. So you've got your 2 products.
Okay.
But that's per person. So if you've got 6 technicians, that's 12 products a year you need to get tested.
Yeah.
So
and when you do your testing, there's several phases of the testing. You've got to do method development, you've got to validate your methods, and you've got to keep them up to date. With Kookaburra Labs, we're a lab that's specifically for compounders to do the level of testing that compounders require. Not too much, not too little, just the right amount. So we will have a very wide spectrum of products that we're used to because we've been testing my products for the last 15 years. We know the mainstream compounding products. We know when they fall out of spec and why, and we can discuss with you confidentially with our team of pharmacists why you may have fallen out of spec.
I really love that. I really love that because I know that back in the old days when you would tell the story of Dr. Chi coming and bringing you some results and you looking at it and it may as well have been written in his native Chinese.
Yes.
HPLC reports that have just got spikes on them.
And then you had to go and do a course just to read the reports coming out of your own lab.
That's right. And so you won't, and this is the results you get from the major commercial labs because they're catering for GMP facilities that have microbiologists, they have biochemists, and they have their own analysts quite often. So they will give you raw data. We will not give you raw data. We will give you the layman's terms, how it's gone. Is it within spec? Is it out of spec?
Yep.
And if it's out of spec, what are the possibilities for it being out of spec? And this is very important because we really don't have time to be experts in everything. So, and this is why we felt there was a need for this because there is no other compounding specialist lab which is Australian owned in Australia. And we've set it up so that the mainstream products can be quoted and tested at an economical price, understanding that you don't have buckets of money to spend.
Or time for that matter, trying to get those things back and it takes a lot of time. You're trying to get people validated quickly because I know like in compounding staff turnover is such an issue and so many people, they'll train somebody up and they up and go somewhere else. So you're getting a new staff member in, you're having to revalidate that person again. And so, when we say if you've got 6 technicians, that's 12 products a year, that's if they all stay put.
Yes.
That's not if you have any kind of turnover or anything. So there could be quite, a significant amount of testing required.
Yes.
So if you've got somewhere that's local that can help you understand understand what's going on with it all, it makes a big difference.
Yeah. And we've been working with Flux as well to design programs for pharmacies so that you can set up your testing program and forget. Basically, the testing program will take care of all of the parameters that you require, and it will make sure and remind you each time a technician is required for revalidation or a product is required for revalidation. So it's something that takes the extra pressure away, and then when if anybody comes knocking on your door, you will have all your data ready to show them, and you'll have backup data as well.
Yeah.
That's it.
Yeah.
It's testing can touch everything, and it's a really important part. But I know there was somebody who told me once, it was a really interesting comment, was that you can't test quality into a product.
No. It's one of those things. The systems have to create the quality, and when it comes down to testing is brutal, and you might have to, if you've got a product that you have to test on a regular basis, sometimes it may fail, and we don't have the ability to do recalls. So it's crucial that we have the ability to scrutinise our systems to see where the product went wrong. It might have been this particular time there was some extra moisture in the air.
Well, that was actually something I learnt from the guys at Kookaburra recently, was with products that are kept in the fridge. So a powder that's kept in the fridge, you have to let it get to room temperature before you weigh it. Otherwise, it can be heavier than it actually is because of the water and moisture content in it.
Yeah, and this is particularly important with triturates, with microdosing. If you keep your triturate, like your T3 triturate, in the fridge, and then you just pull it out of the fridge, make up a product, you may find that you're out of spec if you test that product.
Yeah, wow.
And a lot of people wouldn't think to let it get to room temperature because it's a refrigerated product. You don't want it to get warm. Or in your brain, you don't want it to get warm. But a lot of materials that are refrigerated, they're okay up to a certain temperature. It's just, a long storage issue. But, logically, you keep it in the fridge, you want to keep it cold, right? So it is something that wouldn't necessarily
And there are
have come to
so
light.
many reasons for products to fail. It's amazing. I couldn't believe over the years I've come across, I think, every reason for a product to fail. And we then have to change our systems. And it's normally simple things to change, but you then know that you might have to put a bit of overage in because the product is particularly unstable with the way that the method you're doing. Troches are notorious because you're heating them. And you do lose some product due to the heating. You might not lose enough, but you might lose just enough to fall below spec.
So how do troches get tested?
They do. We do dissolution testing.
Yep.
And when you do troches, one of the most important thing about a troche is the distribution of the drug.
Yeah.
Because the technique between technicians can vary, and the temperature, the room temperature
So it's
of
such
the
a finicky thing to do, really.
Yeah, it depends. There's so many variables. There's technique from the technician. There's heating. There's cooling. At what temperature do you actually pour it? How many? If you've got a couple of troches you pour together, is the amount in the first troche going to be the same in the 60th troche?
Is the suspension of the active drug
Is the
through
suspension
the
all the way to the
Yeah.
bottom? And so
When you get a doctor writing a script for a high potency troche to save their patients some money, and then all of a sudden you've got the 80% of it in one little square.
the notorious 400 milligram progesterone
Yeah,
troche,
which they
every
want-
compounder's worst nightmare.
which they want to cut into a quarter.
Yeah.
One of the quarters can be basically without active.
Yeah.
So it's very important that when we test these, we take a sample. It's a bit like a blend mix, but it's a distribution mix where we take a sample of the beginning, middle, and end, and then we do comparisons of this.
Oh, okay.
That's good.
A lot of labs will just take 5. They'll ask for 5 capsules. They
Yeah,
tip
it doesn't seem like a
they
very
tip
big
the
sample,
contents
does it?
out of the 5 capsules and they average it.
Right.
That's not a good thing.
That
if-
doesn't show you what the distribution
Yes,
was.
there is a 2 different methods to do averaging, and you either test each capsule individually. It's a little bit more expensive, but you know your technician is doing the right thing.
Yeah.
So there's different levels, and this is where it comes down to you can spend a lot of money on testing, or you can spend too little money on testing.
Yeah.
Yeah.
There is a sweet spot, and the guys at Flux are quite in. And if the guys at Flux can't help you, we've got a customer service line, which is manned by very experienced pharmacists, up to 20 years experience in this sort of compounding testing.
I think they're honestly like some of the smartest people I've met
You
in
know,
my life.
yeah. I really love that. The Kookaburra is what there's yourself. There's 1, 2. How many other pharmacists that are on staff there?
There's another 3 pharmacists on staff.
Yeah.
The main QC manager is a pharmacist with 30 years of analytical experience. She's not a community pharmacist. She's been an analytical pharmacist, and she's worked with me in compounding for 20 years. So she knows the compounding world backwards.
Yeah.
She's and that's all she does.
Yeah.
That's all she does.
Yeah.
She knows the Australian scenery, and she teaches me things still today.
Yeah. Not to mention a pretty handy compounding pharmacist on offsider as well.
Yes.
Yeah.
Well, she's got one of the smartest formulators that I know. There's an offsider as well. Yes, that's right.
Yeah.
You like to collect smart people, don't you?
Hey, surround yourself with smart people. Yes. that's my saying. Yes.
Holy moly, it's 2022 and we are excited to do our part to help pharmacists increase the standard of quality across the compounding industry. It's no secret that pharmacy regulators are looking more and more at compounders' education levels. A membership to Flux Pharma means that you have quality assurance education delivered right to you. You can access our monthly streams from your home, office, on the road, wherever you choose. No workshop fees, no flights, no accommodation, no time out of town. Just $49 per month, tax deductible, for quality education in quality management. This is a must-have for any compounding pharmacist wishing to keep up their compounding CPD and improve their business. Remember, in the Australian compounding landscape, quality is a competitive advantage. Visit fluxpharma.com.au and begin your journey towards better quality management today. Let's get back to the show. Yeah.
Definitely. So when somebody's submitting to have a sample tested, On the form, it asks for the method and the specification. What should people be putting in there? Like, I know a lot of compounders, like the method.
What we do is we've got a standard form that when you actually dial into our website, you will see-
Kookaburralabs.com.au.
Yes. So if you dial into kookaburralabs.com.au, that will bring up forms, and you fill your forms in, and we're trying to make it. We understand that compounders are time poor, and you can order your tests just by clicking on, going into the site, specifying the drug and the dose form, and for most of the mainstream thing, you will get an instant quote.
Yeah.
And then you'll press the submit, and then it'll tell you the directions as what we require for the test. We're trying to make it as quick and easy and online as possible. Any testing that is required that is not mainstream, like stability testing or unusual active ingredients or blend testing or other things that aren't basically ID or purity, then you'll be sent off to a side for comments and quotes, and then we'll get back to you within 24 hours on a quote.
Excellent. So with the stability, you mentioned stability testing. How is that different from the validation testing that we've been talking about?
Stability testing is the thing that is actually coming into focus a lot more with the regulators these days, is that pharmacists are making claims based on American folklore. And basically, compounding started in America.
I just had an image of like an old alchemist with his big
That's right. I was handed this formula by a man playing the banjo.
Yes. So basically, the Americans, don't get me wrong, I'm not saying the Americans are dodgy, because they're rolling along with USP 795 and 797.
Yeah.
And in my opinion, they are more going down a better regulatory path than we are
They've
at the
got a
moment.
more robust QA system as a result of
Absolutely.
USP.
There's black and white, robust QA, and whereas we're still a lot of guidance.
Yeah.
And guidance is always dangerous. And until we get out of the guideline scenario and into a USP governance, we're always going to have discussions about how much testing do you need. And it's the USP is absolutely clear on testing. And the other thing that it's was clear on until the new version came out was stability and use-by dates. Use-by dates are one of the most controversial issues we have on the plate at the moment.
Well, I think that's all people were talking about when the APF 25 came out. It was just
well,
all about expiries.
We had the editorial committee of the APF came up with one thing. They received a lot of input from well-known compounding suppliers. That all backfired. Now everybody's running for cover, and it's a mess. It's a dog's breakfast. And the only way that you can look after yourself is by looking after yourself. So if you have a product that is not a mainstream product and you cannot find in the regular wholesalers, the blue people, the green people, or the red people, if you can't find stability data using their products for this particular product, you must do your own stability work. Now, Kookaburra is one of the few, if not the only, compounding lab, specific compounding lab in Australia with our own stability ovens. We can do stability up to 2 or 3 years, and we can give you quotes for that sort of work. Now, you don't need it 2 and 3 years on anything but a commercial product, but I know there are compounders out there with a pet product, and they're thinking about they're thinking about commercialization and even registration of the product, because compounding itself is a self-fulfilling prophecy. You build a product up to a decent size, and then a big guy comes along, picks it up, and commercializes it. So we do commercial product, of course, because we're a TGA lab, so we're doing commercial products all the time, which require up to 2 years or 3 years stability. Compounding products don't require that much. Hospital compounding requires up to 90 days, which is crazy because they're crazy on getting a 48-hour turnaround, but then they want 90 days stability. So we're not quite sure why, but that's the way the market sits. And compounding pharmacists, community compounding pharmacists, are also in the boat where sometimes a doctor will write a large number of products on a prescription.
Yeah.
And if you're going to give somebody 3 months supply, the authorities are going to expect you to have 3 months stability data. And that goes for your raw material, your use-by date and expiry on your raw material, and once it's made, the expiry on that. So if you've got, it's not something you would do on every product,
No.
but if you've got a high volume product
Yeah.
that is not mainstream and you can't find data on, then especially with sterile,
Yeah.
although there's not a lot of sterile compounders, but it is important with
And
sterile.
there's been so much more focus recently, I've noticed, on the references for formulations in regards to suitability and stability and efficacy even of these compounded products.
Yeah.
People are getting pinged because they don't have that data.
Yes. The data
doesn't
that's
exist.
the data that's easy to get is the stability data.
Yeah.
And it's just a process of setting up a stability program which the people from Flux can help you design, and then we can just carry out that, and we can do things on a regular basis, on a rolling basis, on any range of products that you want. Not forgetting that different dose strengths require individual testing. You can't say a 2 milligram product will have the same stability as a 20 milligram product.
Yeah.
So
Yeah, because the different
yes.
concentrations can have
it could be
different
the
effects.
same active ingredient, but it'll require separate studies.
I know my favourite example is always the omeprazole because it's got the logarithmic degradation. So, the higher the concentration, the quicker it degrades.
That's right.
Yeah.
That's right.
The wonders of chemistry.
Yeah, yeah. It's funny. We were talking about weights of evidence with Dr. Lauren Houston a couple of weeks ago, and we were talking about when you have these pet products, these high volume products, you really should be performing a systematic review
Yeah.
to demonstrate and understand, because too many times people are going into their regulators when they've been called in with a big folder full of papers and they go, whack, have at it, here you go.
Yeah.
Yes.
But they're not really demonstrating an understanding of it.
No, they're just saying, look, I found all these papers that have that product named in them.
Yeah.
Yes. There's, and
But,
I'm
my
sure
point-
Dr. Houston went through it as well, but there's a thing called the Nhmrc Pyramid of
Yeah, we did talk about
Evidence.
that. Yeah.
Yeah.
And
there
that-
was references and templates.
And
it
that
was
is the-
fabulous.
and
Bree
that
was
is
in
the-
heaven.
because you've got to think the people that are conducting the S150s are not experts.
Yeah.
You need to simplify
You
it for
need
them.
it needs to be something that everybody can understand, and if it can comply with this NHMRC standard, that should be enough to satisfy. And it's then beholden on the regulator to say if it does satisfy that, why they don't accept it.
Yeah.
And so
Exactly.
this is something that's very important. But in doing that, you've actually got to, if you create a new dose form like I did, you've then got to do a clinical study to prove that this dose form is
Release
equal
profile or-
release profile and,
Yeah.
and bioavailability studies. So if you're going into creating something that it's not a standard, well documented, well proven dose form, then you have to do all this work yourself. And it's important because the regulators, whether they understand it or not, will ask.
Yeah.
And it has to be evidence-based, like whether it's novel or not. And we all know that novel things do work, but you need to have some sort of evidence. You can't just, stick your finger in the air and go, oh, yeah, the wind's going that way.
Yes.
It needs to be based on something, and you need to be able to show that.
Yeah. And Kookaburra Labs is set up to do this fringe work as well.
Yeah.
We understand R&D. Our company actually has a TGA Annex 13 clinical supply license.
Right.
So we understand IMP, which are investigative medical products. And we understand these. And this is where, when you're starting to create new dose forms and the doctor says, hey, I went overseas and I saw this, you're starting to get into the area of investigative medicine. And Kookaburra is there to support you if you need this. We are the only lab that does support these sorts of investigative
You're not
medicines.
just doing the bog standard tests to say, yes, that is that product.
That's right. we find that there's a couple of other labs in the market that are trying to market themselves as compounding specialists. They do the mainstream, And I'm not saying they don't do a good job, and I'm not saying that
And look, there's a place for that.
there's a place for that. There is a market for that, and
Kookaburra does it.
We
Yeah, I was going to say,
and
you
we do
guys
it. We do it ourselves. But then when it comes down to more specialist work, then we do a lot more stability work, things like this. We are a TGA licensed lab. I believe we're the only TGA licensed lab that caters specifically for compounders in Australia, and we're Australian owned. So if anybody feels that we want to keep the money in Australia, and our prices are quite keen because we don't have middlemen who are out brokering for the products as well.
Yeah, right.
Yeah.
When you've got somebody coming to you saying, okay, I think I want to do a stability study, like I know there's a few people out there that when the APF came out and said, okay, you've got 28 days unless you have an exact stability study.
Yes.
Everybody who makes vitamin D3 capsules blew their top because that's, they were putting 6 months on it because you could before. And now it's limited to 28 days. And they're like, I'm not going to make one capsule every 28 days and dispense it, once a month because I can't give them a 6 month supply.
Yeah. Well, something that we find, because the costs are so high, and pharmacists are generally small businesses, they can't afford these costs.
Yeah.
I think something that we've had a couple of groups do, which is quite clever, is they band together, and they might sort of talk amongst themselves, or they might have a small buying group, or the old-fashioned banner groups before we had the major players. But they get together and they say, right, you do vitamin D, you do vitamin D, you do vitamin D. And how about we synchronize our formula and we do a stability study on our formula?
Right.
That way you can amortize the costs across 5 or 6 pharmacies.
Yeah.
So therefore you can have your product and have it properly stabilized. And when the regulators ask for your data, you've got it. But you only pay 20% of the cost for it.
Yeah.
So we're open to that, and we do work with groups on that. Yeah.
I like that very much.
So when they've got a group or done by themselves, and they go, okay, I'm going to come and do a stability study. What do they need to know or nut out, and like what do you guys need to know about that test? What sort of things are we going to look at?
Because most of the stability studies are done on things that at some stage in time we made, we understand.
Yeah.
We understand the time points. We understand the basics of stability of the product. So the pharmacist really can just turn up and say, here's my product, and we can then advise them on time points, because there is a cost of how many time points you do.
Yep.
So we can advise them, this is a very stable product, so you may not need as many time points.
Okay.
This is a very unstable product, so you might have to do closer time points to find out where it falls out of spec.
Yeah, sure. Yeah.
So we can advise on that because we have PhD chemists working with us.
Cool.
That understand the molecular structure of all of the things that a compounding pharmacist is likely to bring to us.
Yeah.
So with anything like this, we can be your go-to point, and this is a free service we offer. The design of the study is a free service. So
cool.
Yes,
Very cool.
yes. So because we don't expect, I'm a pharmacist, I don't expect people to know what my smart people know.
Yeah, sure.
It's,
They don't have the time. Pharmacists, and I think we sort of touched on it with Lauren last week, was that, you've got to be a shopkeeper. You've got to be a formulator. You've got to be a compounder. You've
small
got
business
to be
and finance.
a small business person. You've got to be
OHS
finance.
officer.
You've got to be HR. You've got to be, but
Yes.
then you've also got to be a researcher to back up all the other stuff that you're doing. You need to do your own CPD for how many points a year.
That's right.
There is so many and clinical aspects of it as well. You've got to counsel every patient.
Yes.
All this stuff, it just adds up, and there's so much that needs to be done, but there's only so many hours.
Well,
in the day.
we've set up Kookaburra as an independent operator. Kookaburra is open to the entire market. Any compounder can come to us, and it's really any question is up for grabs. We will not judge any question, and and I'm actually going to talk to the guys from Flux to set up some CPD on testing requirements, because I think it's a field which brings a lot of people unstuck in front of the regulator, because it is very easy to target someone based on this testing and their facility testing and their staff testing. It's got to be QCCP has gone down the right road. And
Yeah, they were weirdly specific. There was like 2 points they were weirdly specific on. They had 10 points in total.
Yeah.
But then there was two. It was that and the actual blood testing. They had a set time frame
Yes.
for that. That was
Yes.
the only things they were specific on.
Yeah, so I think that's the right way to go.
Yeah.
And black and white's always better than guidelines and grey and we feel. So if we can get down, testing is the ultimate black and white.
Yeah.
It's a pass-fail.
Yeah.
Yeah, that's it. At the end of the day,
Yeah.
either it's in spec or out of spec.
Yes.
And when we talk about in spec and out of spec, so specifications, is that something that the pharmacist says this is the specification that I'm expecting, or
The TGA lays down the rules for specifications as well as the USP. So depending on what reference you're using at the time, USP for 797 because the pharmacy board's accepted 797. Hopefully in the future they'll accept 795 as well, which will make life easier
it's
for
crazy
everybody.
that they accepted 797 and not 795 because you need 795 to have 797.
Yes, and this is something that we'll never understand.
The logical pathway there.
It is,
but
and it is, and the beauty of using the USPs, they have an expert panel of hundreds of people that constantly review it. Our regulators would not have to lift a finger; they just follow what's done for them.
Yeah.
And there's no Australianising required. It's common sense compounding, and one day we'll get there, and life will be a lot easier and clearer. But while we sit with guidelines, it's always going to be a requirement that testing is going to be the proof.
Because it is one of those things with all the guidelines, because we have, the pharmacy board guidelines, then you've got it in the APF, and I think there's a small section in the National Competency Standards. There's the PSA Professional Practice Standards. So there's guidelines all over the place. But it's once you piece all the things together that everybody wants, it creates a stock standard quality management system.
Yes.
Which I find crazy that they don't just say, you need to have a quality management system. Like, just tell people that. And that will cover off all those aspects.
Well, as we stand at the moment, the Pharmacy Board of Australia guidelines clash on several points with USP 797.
Well, that's if the pharmacy board decides to keep their guidelines. From what that forum they had, 2 months ago now, it sounded like they just want to get rid of it.
Yeah.
They just don't want to do it anymore.
Yeah, and TGA was on that forum. They were
Yeah.
invited, yes. So that could be an indication of where we're going.
Yeah.
And so he who tests will last, I believe.
Yeah.
Yeah.
Well, I always think that there's a competitive advantage too in
you can
being
show you
able to
tested
demonstrate.
something.
Yeah, that's right. Rather than just looking up a formula, you can show, yep, this is my stability data that I have on my product. The doctors and patients are more likely to come
Well,
around
that's
to
what I was going to say.
you.
As a consumer, I know I've obviously got a different eye on these things, but as a consumer, if you had a pharmacy saying, we routinely test our products versus somebody down the road who doesn't, I know where I'd be going.
Yeah. And prescribers particularly love that. They love that. That was one of the easiest sells that I ever had was going around saying, oh yeah, we do this in our lab within
And
the
here's
facility.
our data.
Yeah.
But it's like without even knowing the results of the test, the fact that you've made the conscious effort to do the testing, I think speaks volumes within itself, really.
Yeah, absolutely. You know what? That was the funny thing is we always used to promote the fact that the stability data are available on request. Never
Nobody
got requested
requested it.
once, never once. But people loved that they could.
Yeah,
they
that's it.
genuinely loved that they could.
That's it.
Yeah.
Having that option there,
Yeah.
it just opens
Yeah.
up.
And
so
also,
much.
too, usually the only ones that would request will be the regulator.
Yeah.
So you have to have it. You have to have it. Don't wait. Just if you do it as a routine part, you have a program that's set up and it's a routine part of your pharmacy operation. It's built into your overheads and your costs. You will never have a problem with paying for it.
Yeah.
If you wait till you get caught and you've got to test 10 products,
Oh, ouch.
it'll
it's bury
usually-
you. It'll
the horse,
bury you.
And the horse is bolted already because the product that they're already scrutinising has not been tested.
Yes.
That's it.
Yeah.
And then if you
And it
test
hasn't been tested for years.
Yeah.
Yes.
Yeah.
That's it. Yeah, a lot of these things where you have all this remedial action after you've been caught on stuff, I feel like it never works as well as if you've just done it in the first place. Like, even if you've done it and you've tested it and it is good, they're still going to look at it and go, yeah, you tested it, but is it actually a good test?
Yeah.
Like, it's one of those things where...
It becomes grey, but it's not black and white. If you haven't tested, it's black.
Yeah.
Yeah.
That's
And in my pharmacies, I always tested even when I didn't need to test, I always tested. And that resulted in not one patient complaint in 30 years, not one major adverse reaction in 30 years. And it was all because I had confidence in my products, because I used to test them, and my patients got the benefit from it.
What about testing raw materials?
I was just about to raise that. Look, I mean, from time to time, there are plenty of compounders out there that are testing that are bringing in their own raw materials. Skipping the wholesaler
or finding a cheaper place to buy it from,
that may not have all their ducks in a row. The product's fine, but they don't have all their documentation.
Well, I've seen plenty of dodgy C of A's in my time.
Yeah,
there's some interesting documentation that floats around from Chinese suppliers. I'll tell you that much.
Yeah. I would be loath to sort of trust a lot of that. When the that can be easily solved. By sending a sample off.
If there's
what's
a product
involved with that?
If you're using a very small amount of product, I still would recommend running through the standard wholesalers, because they've done a lot of testing.
Yeah.
Yes.
And I know the two of them, the third one, actually there's three of them have basically done a lot of testing. But if you're a pharmacist that uses a lot of one product, you might buy 20 kilos of a product. Now, there's no way you're going to get them from the red, green or blue people. So you have to then do full compendial testing.
Yeah.
It's outside of normal compounding, importing your own goods.
Yeah.
You must get an import license for it.
I was going to say importing within itself.
Yes. You must do that. People get caught all the time importing without a license, because it's easy to ring someone up and get some shipped into you.
Yeah.
But you have to have an importing license.
And Australian customs is just next level. The things that they ask for, we always used to joke, you get the question of how many people can you fit in the weigh boat?
Yes.
Because you've got these people.
Is the weigh boat made of wood?
Yes. Like all of these things. But you do get these questions, and I know in my wholesaler days, you'd get pages and pages of questions on ingredients that were being imported.
Crazy questions.
And the license, like, depending on what products they were, and there was no list that said, these are all the products, these are the permits, these are the licenses, because there's different levels. There's permits, there's licenses, there's extra payments that you need to make on particular products. There's agriculture licenses, there's scheduled license. It's just, but there's no master list that tells you what it is.
Yeah.
So people would get caught all the time.
But in saying that, if you are using a lot of a product, there is significant savings to be had.
Yes.
Even after testing.
Yeah.
But the testing must be full compendial.
And full compendial means everything that's on that C of A, right?
The full compendial means what the whole barrage, the whole battery of testing that's in the pharmacopoeia. And you either test it to a USP or you test it to a BP standard.
EP?
You can do EP or JP. And actually the Chinese pharmacopoeia is now part of the World Pharmacopoeial Society.
Oh,
Right.
really?
But you need a Chinese analyst generally to use the Chinese pharmacopoeia.
Well, I remember it very
Have you got one of those?
Oh, yeah, have one of those.
There was a really interesting instance at one point where there was a product you bought and it said USP, but it was actually Chinese pharmacopoeia. So it was a pharmacopoeial standard. When it was tested, it was actually 3 times the strength.
That's right.
So when you are picking your different pharmacopoeial standards, you do need to be mindful.
It was thyroid extract.
Yeah.
The thyroid extract that came out of China was tested to the Chinese pharmacopoeial standard.
Which it complied pharmacopoeial
Which it complied
standard.
with, and it wasn't rubbish, it wasn't weak, it was super strong.
Yeah.
And so you've got to be very careful.
But lucky it was tested, right?
Most of the formulas that are rolling around the traps from America are USP. So be very careful if you test something to a different pharmacopoeial standard to the formula that is being used, because you can get different, the pharmacopoeial standards can change.
Because it can even be like I know melatonin BP versus USP, the colour can be different, significantly different. And, just looking at the products, you go, oh my God, it's out of specification, but it's actually, in fact, just a different pharmacopoeial standard.
Yeah, so compounding in Australia generally uses USP. Because we have our pedigree. Most of the major suppliers of product are American.
And the labels are in English.
Yes. But the TGA actually subscribes to the BP. They don't particularly like the USP. So that's just another little sort of
Well, the APF,
twist.
the APF refers to BP a lot. Like water, any of the water that you put in your compounded products needs to be BP grade water.
Right.
And be careful with if you're using research literature searches for your stability, because the regulators don't recognise water, EP water versus BP water. So if you use BP water in Australia and the data that you've got on the
EP
product
water.
is EP water, they won't accept it. Personal experience.
Wow.
Wow.
Yes. So it's
I'd like to
That's
see
when they
those
drill
two
down.
pharmacopoeial standards next to each other and see what the actual difference between EP and BP water
well,
is.
I'm sure that was never depth was never gone into.
Yeah,
It was-
I'd like to see the two of them together in a regulator reading them. I don't think we're ever going to see that either.
Yeah, it was just spotted as EP
I
and
just imagine like
BP.
peeling peanuts and they got like
B,
the little
E,
cartoons.
they're different letters, damn it.
Yeah.
I've got him.
So basically, yeah, it comes down to doing your own stability is by far the most effective way to guarantee a good result.
Well, and then I guess
And-
you know that there's no commercial bias in that respect, that you have actually had that product. It's not somebody else trying to sell you that product has tested it and said, yeah, I tested it, it's good.
Yes.
You've actually had the actual raw
Yeah.
result.
And something that we also find has happened to us before is products that fall sub-spec. The raw material could be sub-spec. So at Kookaburra, because we do not supply raw materials, we will never disregard the raw material as being
That's an option.
sub-spec.
Yeah.
We are truly independent.
Yeah, it's definitely, it's one of those things for root cause analysis. You've got to look at
Yeah.
every
If
part
you
of it.
if we were a supplier of raw materials and the raw material came from a competitor, we of course would consider
yes, definitely
we would
too.
consider that raw material as one of the root cause problems. But because we don't supply any raw materials, we look at it very objectively.
Yeah, it's definitely, and like I said, you've got to look at all of it objectively. In this sort of environment, when you're testing, it has to be objective. There can't be any kind of biases in there, because you could have the perfect technique, you could have the best equipment in the world, but if your material is crap, your product's crap.
That's it.
At the end of the day,
It's sub-spec. Yeah.
yeah, sub-spec. Crap's the technical term. So,
Yeah. All right. Well, I don't know if we've got anything else. So that seems like a good place to wrap up. Is there any final thoughts, Daryll, that you may have there?
My final thought is that was then, this is now. Test. It's the only escape that you will have.
Great. Now, what we all should do now is go and check out the website for Kookaburra Labs. That's kookaburralabs.com.au. You'll find plenty of information there and booking forms and all sorts of stuff to be able to see. Now, I know that in the promotions for this, we talked about our special guest being Daryll Knowles, and this is probably not the story that anyone wanted to hear about from Daryll.
it's not the juicy
It's not the
goss.
juicy story. However, I'm pretty sure I'm going to put it on him right here and right now. Daryll, do you think we can get you back again sometime soon to talk about some other stories that may be going on in compounding surrounding yourself?
Absolutely.
Wonderful. Tune in for that one.
Try
Don't
and
worry.
stop him.
He'll come in wearing a suit of armour that day. All right then. Well, look, that was really great, Daryll. Thank you very much for your time.
Thank you.
Okay. Thanks
Thanks a
guys
lot.
for
We'll
having
talk
me.
again soon.
My pleasure.
Yep. See you soon.
Okay.
Bye.
Bye.